Very good afternoon. I'll be speaking on role of preoperative anti-VEGF in altering the macular status in PDR with vitreous hemorrhage. Well, visual performance in diabetic retinopathy is mostly related to macular status. Hence, many a times, even after a successful vitrectomy in proliferative diabetic retinopathy with vitreous hemorrhage, visual performance is not good. This study evaluates the macular status with OCT 1 month after the vitrectomy for the proliferative diabetic retinopathy with and without adjunctive use of anti-VEGF pre-op. So this was a prospective randomized case control basically study. It was a cross-sectional study of 217 eyes. The inclusion criteria was of course PDR with vitreous hemorrhage, and exclusion criteria was eyes with macular tractional detachment with coexisting retinal vein occlusion, etc. So these were evaluated with SD-OCT, and qualitative and quantitative characteristics of SD-OCT such as ELM, ellipsoid zone, epiretinal membrane involving the fovea, hyperreflective foci, etc. were analyzed. So group 1 consisted of 107 eyes which underwent 23 gauge vitrectomy with addition of anti-VEGF, and group 2, 110 eyes did not receive any anti-VEGF preoperatively. All the eyes underwent MIVS. Now if you look at the results, it will be interesting to note that the important parameters such as center involving DME was more in the no anti-VEGF group, as also the external limiting membrane disruption, etc., and the central macular thickness was also more in the no anti-VEGF group. So age-sex ratios were similar. Visual performance in the two groups and macular thickness was statistically analyzed, and the t-test difference was statistically found to be significant. The eyes with disrupted ellipsoid zone were noted to have statistically poorer visual acuity in both the groups. So this is the representative OCT 1 month after the procedure, but it's interesting to remember that this is just the beginning, because these PDR patients will have to have repeat OCTs and maybe many anti-VEGFs or steroids down the line. So studies that have reported anti-VEGF agents have mostly concentrated on use for intraoperative reasons and not for postoperative evaluation. So center involving macular edema was less with anti-VEGF in this study. Clinically exudates were more without anti-VEGF, and we also reduced to reduce the heterogeneity of the cases. We did not take up patients with macular TRD. So to conclude, to our knowledge, this is the first study to look at macular status with OCT at 1 month following vitrectomy with PDR for vitreous hemorrhage, and judicious use of anti-VEGF therefore before vitrectomy in diabetic PDR can help reduce surgical complications and also preserve better macular anatomy and give back better vision to the patient later on. Thank you for your kind attention.